Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is lentigines. Definition of lentigion is a lentigo, plural is the lentigine, is a small pigmented spot on the skin with a clearly defined edge. It is surrounded by the normal appearing skin. It is harmless, so it is benign. Hyperplasia of the melanocytes, which is linear in its spread. This means hyperplasia of the melanocyte is restricted to the cell layer directly above the basement membrane of epidermis, where melanocytes normally reside. This is in contrast to the nest of the multilayer melanocytes found in the moles, which is called melanocytic neva. So here one can see the lentigines, the spots with a clear margin. Here again one can see the spots with the clear margin. So this phenomena of having so many lentigines is called lentiginosis. Now, adjective lentiginous is used to describe skin lesion that proliferate linearly within the basal cell layer. Lentigo is a medical term for a skin condition commonly known as liver spots. Lentigo or the liver spots are flat spots on the skin that are darker than the usual skin tone. They are not itchy or the painful. These spots resemble certain types of the skin cancer. Lentigo is non-cancerous. Lentigo spots do not need to be treated, but sometimes cosmetic reason the treatments are available and these are given. So here again one can see the lentigines and these are the spots on the hands and on the face. Now these are benign discrete hyperpigmented macules, more common in the fair skinned people. These are 1 to 5 millimeter macule, darker than the freckles, and can occur on any cutaneous site, including the mucous membranes. So there is seasonal variation and it manifests during the early childhood and disappear during the adulthood. So that is the variance. Lentigo cannot be differentiated from a junctional nevus or the mole, but histologically these are distinct and on biopsy one can differentiate these both. Sometimes disappear on their own over time, but most do not go away. Other types can only be removed with the treatment because of the cosmetic choice, as I have already mentioned. As one gets older, one notices spots on the skin that are darker than the natural skin color. These spots are especially common on the sun-exposed areas like face and the back of the hands. Multiple spots are called lentigines. The name is because spots can resemble lentils in color. They are also called liver spot or the age spots also. A lentigo can grow very slowly or appear suddenly. They may have rounded or uneven edges. Sometimes lentigines can appear in the different area of the body depending on their cause. Now, what are the symptoms which one can have cause of the lentigines? Lentigo does not cause any symptom, only the spots are present themselves. They are not itchy or painful. The main symptom of the age spot include the color. They are light brown to black in color. They are darker after time in sun. And about the texture, The spots have same texture as rest of the skin. They are flat to touch and any does not cause any pain. Continuing the symptom, the size, they vary from the size of a very small freckle to an inch in diameter, and the grouping, they appear on their own or in groups, which make them more noticeable. As regard the shape, typically round or oval with very well defined margins. I have already shown you. The beautiful people are not always good, but good people are always beautiful. So the beauty lies in the eyes of the person, and the good people, they look beautiful because of their good habits and their good things toward the other. So that beauty is more lasting than the face beauty. Now, how to identify lentigo? Lentigo look like other dangerous skin conditions like melanoma, basal cell carcinoma, and other skin cancer, but lentigo spots are flat and evenly colored. Skin cancer produce spots that are raised, painful, itchy, and they grow very rapidly in size. They are, they have got uneven borders and they have got multiple colors. So these are just giving the suspicion of some cancerous lesion. Here one can see the lentigo, and here one can see the melanoma, that is just cardinal features of five. They are having the asymmetry, B for border, C for color, D for diameter, and E for elevation allotment. For if these are present in any this kind of spot, one can think of melanoma. And then basal cell carcinoma, that is least malignant and non-cancerous but most common skin cancer. It occurs most often in the sun exposed areas, shiny dome shaped nodules, central ulcer with pearly edge and slow growing. So these are the features of basal cell carcinoma, and one can differentiate it from lentigo. Now, risk factor of the lentigo. Anyone can get this lentigo, primarily caused by the sun damage, or anyone of any age, gender, or race who spends time in the sun is at the risk of having this lentigo. More in people having fair skin and having lot of sun exposure or sunburn or indoor tanning, they are also having the risk factor, and phototherapy or the radiation therapy, that also predispose to have the lentigo. Now, what are the causes of lentigo? Lentigo is primarily caused by the sun exposure. The sun's ultraviolet radiation cause skin cells called melanocyte to produce more pigmentation in the skin. So the people tan, burn, or freckle after spending time in sun. Over years, the damage from the ultraviolet radiation cause pigmentation deposits in the skin. These spots, these deposits can build up and form lentigo, and are also seen in certain inherited syndrome which are rare and present at birth. So that is seen in Banayan Riley Kaba syndrome. There is a large, larger than normal head and non-cancerous tumor and dark spot on the genitals, that is in this Benyon Riley Kaba syndrome. Then there is the Cowden syndrome, many non-cancerous growth called hematomas to form on the bodies. Then Noonan syndrome, lentigines form on many different parts of the body. And here one can see the Benyon Riley Kaba syndrome, the lesions on the genital and on the other parts of the body. And here there is a Cowden syndrome, and here it is Noonan syndrome, where one can see the different spots on the body. So these are the rare diseases, but it have been seen. Similarly, Peutz-Jeghers syndrome, non-cancerous growth to form in stomach and intestine, high risk of developing cancer. Children get small dark spots on their faces, lips, hand, feet, genitals, and inside of the mouth, and these spots will fade with age. Then xeroderma pigmentosum. This makes the people extra sensitive to the ultraviolet rays from the sunlight, and there is increased risk of developing skin cancer. And here one can see the Peutz-Jeghers syndrome, a rare autosomal dominant condition, and one can have the polyp in the GI tract, then melanotic macules on the mouth, lips, genitalia, palms, and soles. And here there is symptom and signs of the xeroderma pigmentosa. One can have the freckles, photophobia, skin cancer, tumor of the eye, and other premature skin aging, and all the problem which are the neurological problem also seen in the xeroderma pigmentosa. Continuing the causes, lentiginosis profusa, that present with the multiple deeply pigmented macules present at birth or in early infancy, no systemic or developmental abnormalities seen. Then the Leopard syndrome, which has multiple lentiginous ECG abnormalities, ocular hypertelorism, pulmonic stenosis, abnormal genitalia growth, retardation, and neural deafness, all the features of this Leopard syndrome. It manifests during infancy. And here one can see lentiginosis profusa and Leopard syndrome with multiple lentiginous on the different part of the body.